of conditions like golfer's elbow and tennis elbow that cause elbow pain. You know, tennis elbow being this outside part of the elbow, golfer's elbow affecting this inside part. And, you know, when we see patients for those conditions, they've typically tried everything else, like physical therapy, maybe even steroid shots, you know, medications, even, you know, bracing it while they play their sport, and they're just not better. They're not where they want to be, and they haven't healed that tissue. When it comes to these conditions, and I'll just, you know, talk about the lateral elbow specifically, but it's the same on both sides, is you actually have a collection of muscles in the forearm that converge into a common tendon that attaches, you know, at, you know, the bony aspect of the elbow. Underneath that, you have a lot of ligaments that help to stabilize all the bones of the elbow as well. So you've got, you know, layers of very important structures there that you need to be healthy to do things like play tennis or golf. You know, when patients come in and they have tried all these other therapies and they haven't gotten better, what I typically like to do that's really easy in the office is ultrasound it first. Are we dealing with a tear? Are we dealing with degeneration? You know, and an ultrasound will be able to tell us that. The reason that's important is it may dictate our care. When someone comes in and they just have degeneration of that tendon, there's no tear, you know, they may respond really well to dextrose prolotherapy on its own, where we inject dextrose and attract growth factors and so forth to the area. When someone has a tear, or maybe even a, you know, tendinotic tendon that hasn't, you know, been healing as well as we want, what we can actually do instead of just injecting dextrose is we can take cells from the patient. We'll draw blood, concentrate growth factors out, which is called PRP, or platelet-rich plasma, and then we can actually directly put them where the tear is, you know, or the, you know, biggest area of degeneration, as a more aggressive way of healing that tissue. Now, one of the big things too to consider with the elbow is, you know, rehab. If patients are keeping their elbow by their side, which we often recommend they do in the beginning stages of treatment, you know, there's not really any pressure on the elbow. It's just kind of hanging out by the side. But if they, you know, kind of bring their elbow out or out here, or they're constantly, you know, maybe playing tennis when they were advised not to, what happens is you actually put more stress on the elbow the farther it's out. So also, you know, adhering to a rehab protocol is crucial to get, you know, patients better with tennis and or golfer's elbow.